This lecture will focus on OT personnel, education, roles, responsibilities, and supervision. There are three objectives for this lecture, and they are to 1. Distinguish characteristics of occupational therapist and occupational therapy assistant partnership and articulate the need for supervisory roles and responsibilities, clarifying various capacities in which the OTA practitioner may function, such as in care coordination, case management, and transition services. Objective 2, state strategies for effective competency-based legal and ethical supervision of non-professional personnel. And number 3, demonstrate knowledge and understanding of the American Occupational Therapy Association, AOTA, Occupational Therapy Code of Ethics and Ethics Standards, guidelines for supervision roles and responsibilities during the delivery of occupational therapy services, and standards of practice and how these guide ethical decision-making in occupational therapy practice. Every occupational therapy and occupational therapy assistant program starts with an accreditation body. Our accreditation body is the Accreditation Council for Occupational Therapy Education, or as we all know it as ACOTE. ACOTE regulates entry-level education for occupational therapy and OTA programs. What is entry-level, you may be asking? Entry-level is the minimum amount of skills needed to safely work out in the field. ACOTE sets the standards for each educational level, and each school must comply with these standards in order to be considered an accredited body. As of the 2011-2012 Annual Data Report, there are 4 accredited doctoral programs, 145 master's programs, and 159 OTA programs nationally. There are also 5 doctoral programs, 3 master programs, and 23 OTA programs who are considered to be candidate programs. This means the program can admit the students but have not completed the on-site evaluation by ACOTE to be considered accredited. There are also 5 doctoral programs, 1 master program, and 24 OTA programs that are considered applicant level. Applicant level means that the academic program has submitted a letter of intent to apply for the developing program. In order to become an OT, you must graduate from an accredited college program with a master's or doctorate degree in occupational therapy, complete 6 months of level 2 fieldwork, pass the NBCOT exam, and meet state licensure requirements before calling yourself an occupational therapist. In order to be an OTA, you must graduate from a 2-year accredited program, complete 16 weeks of level 2 fieldwork, pass the NBCOT exam, and meet state licensure requirements. In some settings, OT aides are being used. Their role is to provide supportive services to occupational therapy practitioners. They have no specialized academic training, usually have a high school diploma or equivalent. Their training is on-the-job training. OTAs must comply with state and federal regulations. They may be assigned to perform delegated, selected, client and non-client related tasks for which the aide has demonstrated competency. This slide shows the comparison of salaries from 2009 to 2012 for OTs and OTAs, and this is for California. These numbers come from the Advanced Magazine Salary Survey. OTs in California and in every state do a survey, send it to Advance, and that's how they get their average range where the salaries are. The roles for the occupational therapy practitioner includes consumer educator, fieldwork educator, supervisor, administrator, consultant, fieldwork coordinator, faculty, program director, research scholar, and/or entrepreneur. As an OTA, you will educate the consumer on what occupational is and why you are doing a specific treatment technique, to letting them know about a resource that will be beneficial for them or their family. Once you work out in the field, you can be considered a fieldwork educator, which means you can take students from this program or any other program for fieldwork 1 or 2. You will supervise students and aides on the job. You can become an administrator like I am and a manager of a program using your OT skills and knowledge. For some of you, becoming a faculty member may be of interest to you, and this is a role you can take on if you have a bachelor's degree on top of your OTA license. If you aspire to become a program director like Ada, you can do this also. If research is your thing, you can assist with an OT on a research studies and get your name on evidence-based studies. As an OTA, you can become an entrepreneur of your own company. The sky is the limit, no matter if you're an OT or an OTA. Roles are not exclusive. You will probably do more than one role on the job, no matter where you work. For some roles, you will need to get more advanced degree, but not all roles require this. There are 3 different levels of role performance. The first level is entry-level role. Within this role, you are developing your skills, learning the policy and procedures of where you work, and getting to know the culture of your organization. The second level is intermediate level. Within this role, you are increasing your independence and mastering your basic skills. You are able to pull from previous situations to respond to other situations, and this is the time you can take students to assist them in their education. The third level is advanced level. Within this role, you are refining your specialized skills such as learning NDT, P&F techniques, and you understand the complex issues affecting role functions. Other specialized roles an occupational therapist or OTA can do is activity director, case manager, rehab coordinator, and a dean of a department. Within these roles, you will use the skills you have obtained over the years and use them in those roles. The definition of supervision is a process in which 2 or more people participate in a joint effort to promote, establish, maintain, and/or elevate a level of performance and services. Nowhere in this definition does it say one person is the boss over the other. As an OTA, you are required to be supervised by an OT. There are state supervision guidelines that must be followed. The OT is responsible for overall delivery of OT services and is ultimately accountable. The OTA delivers OT services under the supervision of the OT. The OT selects and delegates services delivered by the OTA using the following factors: the complexity of the client's condition and needs, knowledge, skill, and competence of the OTA, and nature and complexity of the intervention needed. When I say the OT delegates services, this does not mean that the OT will tell you exactly what to work on with the patient, such as go and work on upper body dressing or use the game Uno to work on cognitive skills. The OT will set up the treatment plan, and on that treatment plan it will say work on ADL retraining or cognitive tasks to address the following directions. This means the OTA will then go into their bag of tricks and find the correct treatment intervention to work on those skills. Service competency must be demonstrated and documented prior to delegation of any aspect of service delivery. This means you have to show that you are competent to do splinting on a patient before the OT allows you to do splinting on your own. Service competency is determined by various methods that 2 people performing the same procedures will obtain the same results. This is important when doing standardized testing. Used to demonstrate and document clinical reasoning and judgment, as well as specific techniques, assessments, and intervention methods. The method and standards to establish service competency vary depending upon the procedure involved, and it is recommended that the standard of performance be met on 3 successive occasions. Supervision is a cooperative process to establish, maintain, or elevate the level of competence and performance, aimed at ensuring safe and effective delivery of OT services and facilitation of OTA's professional growth and competence. OT develops a plan for supervision that includes input from the OTA regarding frequency of supervision, contact method or type of supervision is needed, contact areas addressed. The frequency, method, and content vary by practice setting and depending upon the skills of the OT and the OTA, the complexity of the client's needs, and the requirement of the practice setting. A variety of methods should be used, including observation, co-treat, dialogue, discussion, teaching instruction, electronically, and telephonic. Supervisory plans should be documented. The OT, OTA, and OT aid require different types of supervision. These include, for the OT, is independent in service delivery after certification and license. Recommend that they receive close supervision at entry level and general supervision at intermediate level. For the OTA, close supervision at entry level, weekly supervision per state's licensure regulations. For an aid, non-client related tasks, usually minimum supervision. Client-related tasks, usually in line of sight, supervision is required. The difference between close supervision and general supervision. Close supervision is that it's more than once a week. Generally, it can be 2 to 3 times per week. It could be that the OT observes you or having multiple discussions throughout the week about the patient. General supervision is once a week that is set up per your state licensure regulations. There are different styles of supervision. One is directive behavior. The supervisor tells the supervisee what, when, where, and how to do something, and then closely monitors the performance. You may see this in the construction world. There's also supportive behavior. That's the process of listening, encouraging, and facilitating the supervisee in decision-making and performance. This is a good style of supervision when an OT and an OTA is working together. Some of you may have a mentor assisting you through the process of becoming an OTA. A mentor is a combination of a wise advisor, a teacher, and a coach. The mentoring relationship goes beyond teaching, usually deeper and more holistic than a teacher-student relationship, develops over time, involves more than professional knowledge. A good mentor will challenge you and will make you think and not just give you the answers. They will be brutally honest, and because of this, you become a better person. They create an environment of trust, provide specific knowledge and/or resources to encourage professional and personal growth, encourages a mentee to consider alternate views and opinion, acts as a role model and motivates mentee to take risks, and also stimulates critical thinking. In summary, you learned from this lecture about what ACODE is and their role in setting the standards for educational programs, the roles of OT and OTAs, supervision guidelines, the different types of supervision, and what it takes to be a good mentor.